Hey everyone, greetings. Dr. Lipi Roy here, and I'm filming here from Hollywood, Florida at the ASAM conference. That's the American Society of Addiction Medicine, and I am so thrilled to have our guest, Dr. Emily Brunner, who's a family medicine and addiction medicine doctor here. I'm going to interview her. She's going to tell us about all the cool stuff that she does. So, Dr. Brunner, tell our viewers a little bit about you and the work that you do.
I am both a family medicine and addiction doctor, and I work with patients at a detox in Minnesota, as well as I do training work for other young learners with Hazelden and Betty Ford and work across the country.
Wow, that is fantastic. Folks, we need a lot more doctors like Dr. Brunner and a lot more NPs and PAs and other healthcare professionals who are trained in addiction medicine. I know that you also treat patients with opioid use disorder and you use a medication called Buprenorphine. Can you tell folks a little bit about this medication?
Yes, so you might have heard of this as Suboxone. It's often referred to that. And it is a medication that reduces the risk of death by 50%. So if there's one thing that I would hope to get across, it's how much hope and joy lies ahead for many people with opioid use disorder. There's not a hope. It's absolutely transformation is possible.
I love that you said that because I'll tell you folks, I've also been honored and privileged to take care of patients experiencing various forms of substance use disorders, including opioid addiction. And when I started treating people with this medication called buprenorphine, commercially known as Suboxone, I have never received so much positive feedback from my patients expressing their gratitude and just frankly listening to them and not treating them with shame and judgment and saying, hey, reminding them that, hey, addiction is a chronic disease. Relapse happens just like it does with all other chronic illnesses like asthma and high blood pressure. So thank you for sharing that story, and that resonates with me and my patients as well. I also know that you are scheduled to give a talk today on gaming 101, and tell us a little bit more about that and for our viewers what that is and can it be treated?
Yeah, so internet gaming disorder is the official diagnosis name, and it's not a common diagnosis. The vast majority of people who play video games do not have this, but there is certainly a small subset of people who develop issues with other functions in their life. So that's really where it becomes a problem, when it is impairing your relationships, your work. My very first patient was actually referred to me by a professional organization because he was unable to continue to practice his work because of gaming. And he was telling people that, and they were saying to him, no, that's not that's not what your problem is. And I think that's where like our experience of authentically listening to people, right? And delivering patients that like always the most important person is the patient and what
Absolutely.
the patient tells us, and to tell them no. I mean, so
It's invalidating, right?
yeah, I get on that soapbox like, okay, let's just believe.
Let's just take their word. Let's just listen to them,
Yeah.
what their issues are, and just so we're clear, so I'm clear. Gaming refers to like video games, like a Fortnite, back in my day, Pac-Man, whatever.
Yeah.
But it's even like on your phone playing games, right?
Candy Crush, right? And I'm not a teetotaler for video games by any means.
Right.
I enjoy playing some myself. I have the purple hair to prove it.
Look how cool and funky she is, right?
But it's when it's a continuum. Just
Right.
like the vast majority of people who drink do not have a problem with it.
Yeah, I'm so glad you brought that up because here in the United States, we treat drugs and frankly addiction in general, but especially like substances in a really archaic way, right?
Yeah.
It's also very racially driven, but we think that, oh, all drugs are bad. But the reality is, and again, we learned this in our addiction training, we learned that the vast majority of people who use drugs do so recreationally. What maybe at best, at most, maybe 10% go on to develop an addiction, and it's because of certain traumas and background and all. So anyway, but tell the viewers a little bit about how right now, how do you treat gaming disorder? People who go on to develop behaviors that are adversely impacting their health related to gaming.
So I want to be clear that all the evidence is sort of initial and primary. So with We go with cognitive behavioral therapy, which is a specific type of therapy with goals. And also, I've used both an antidepressant called bupropion, as well as a medication, naltrexone, that we also use to treat opioid use disorder, alcohol use disorder, and gambling disorder. So it's a very useful medication in the population of people with substance use
And
disorder.
naltrexone as a pill, or is it
It's a pill.
Okay.
It can
Excellent.
be the IM version too.
Okay.
Hard to get covered by insurance when
Yeah.
you're saying that it's for internet gaming disorder. They're not a fan of that.
But well, trust me, exactly. But and for those who might recognize, bupropion is also commercially known as Wellbutrin. So, well, first of all, thank you so much for the work that you do. I'm sure your patients feel extreme gratitude knowing that Dr. Brunner is on their side. Folks, I'm so honored to call Emily my friend as well. I'm so honored to be able to share her story with all of you. Stay tuned for more amazing information from this conference, and stay tuned for subscribe to my channel, at my show, and follow me on Instagram at Health Humor Harmony, Dr. Roy. I'll see you next time.